Thank you so much. Good morning, Chair of the Executive Board, Dr. Al-Kohari, Executive Board Vice Chairs, Executive Board Rapporteurs and members. Good morning, everyone. Before I go any further, I'd like to congratulate Dr. Balki and Dr. Bukhali on their respective nominations and appointments. Our journeys start at the same time, and while our paths might be different, our destination is the same. I look forward to walking alongside them as we work towards a common good of our respective regions. I'd also like to thank my outgoing Regional Director, Dr. Poonam Khetrapal Singh. Her vast experience and outsized contribution to the public health of our region leaves me with big shoes to fill. I look forward to the challenge and to drawing on her guidance and experience. I must, of course, also thank our leader, Dr. Tedros, our esteemed DG, for the warm welcome he has extended to me. I know that with his close cooperation and partnership, our Southeast Asia region will be able to face any challenges we may encounter in the next 5 years. I'd like to thank Bangladesh for nominating me and our member countries for electing me for this important position and trusting in my leadership. Throughout the election process, I consistently made a public commitment to take a collaborative approach to the office of the Regional Director if I'm elected. This is a promise I plan to keep. I will not forget that I govern with the consent of our 11 member states. It is their needs that I will address, and I will work with them to create solutions that are crafted for their individual circumstances and realities. And it was really wonderful to attend the active participation of member countries at our executive board meeting. To our country officers, I'd like to assure them that I will work closely with them during my term. My office will be a conduit for them through which we can together implement the One WHO philosophy. Our organization rightly enjoins us all to focus on priorities which have been outlined for all regions, and my office will work tirelessly to implement these in Southeast Asia. Further to this, I will also bring a focus to additional priorities that I championed during the election campaign. The first of these is a strong focus on mental health. I know all of us in this room recognize the importance of this long neglected area. It is time to turn the tide against the silent illnesses of mental health, which impacts every aspect of the lives that are affected. I will work towards ensuring relative parity between physical and mental health in our healthcare systems. Secondly, I look forward to devising and implementing specific interventions for women and children, including pregnant women. This will be created with education, empowerment, and prevention in mind. Structured with the life course approach, this will include comprehensive well-being and health screenings, vaccination and nutrition programs, and promotion of both physical, mental well-being, and resilience. Any success we achieve in this area, we will have multi-generational impacts and benefits, which will potentially outlive us all. Successes in this area cascade through societies, even improving the social and economic health of communities. Third is the use of technology. This great enabler in our lives over the last few decades allows for untold possibilities of innovation across many different spheres of public health. I intend to harness technology for the digitalization of our health system, as the benefits of this are both people and country-focused. The impact of the digital revolution on healthcare holds immense promise, ranging from telemedicine and remote patient monitoring to data-driven diagnostics and personalized treatment plans. Everything that we intend to do will require partnerships, collaboration, and of course, financing. Financing needs to be transparent, sustainable, and has to provide an adequate return on investment. Improving the health of populations requires addressing many determinants within the health sector, but also beyond the health sector. That is why I will explore potential partnerships and collaborations with cabinet members in our member states in portfolios beyond health. Those partnerships also give us innovative opportunities for non-traditional financing, because our life course approach allows us to improve health outcomes using budgets which are housed in non-health portfolios. I'd like to thank member states for the trust they have placed in me, and I thank you in this room for reaffirming their voice and choice. There is a lot of work to be done, and I'm extremely pleased to be starting this journey at this moment in our headquarters with all of you. In the coming months, I will call upon your guidance, your advice, your partnership, and your friendships. I am excited for all that we can and will do together in the coming years and on behalf of Southeast Asia. And finally, I'd like to express my big thanks to Prime Minister Sheikh Hasina, not only for the leadership she has demonstrated over the decades of governance in our country and in our region, but also as my mother, for teaching me how to lead with compassion and care for people who are disenfranchised and needy. I hope that I can take her life lessons and use that as a way to lead the Southeast Asia region. Thank you.